Gramina Ayurvedic Medical College, Terdal, Karnataka, Department of Rachna Sharir presents Anatomy of Duodenum. Myself, Dr. Srikanth Visrawat, Assistant Professor, Department of Rachna Sharira. In this video, I am going to explain about anatomy of the duodenum under following headings: introduction, location, dimension, parts with its relation, interior of the duodenum, suspensory ligament of duodenum, duodenal recess, neurovascular supply of the duodenum, and clinical anatomy of the duodenum. The duodenum is the first, shortest, widest, and most fixed part of the small intestine. It extends from the pylorus to the duodenojejunal flexure. It begins at the pylorus, which lies on the transpyloric plane about 2.5 cm to the right of the median plane, and ends at the duodenojejunal junction, which lies about 2.5 cm to the left of the median plane and little below the transpyloric plane. The duodenum is retroperitoneal except the proximal 2.5 cm, which is suspended superiorly by the lesser omentum and inferiorly by the greater omentum. The main function of the duodenum is digestion. It receives chyme from the stomach and mixes with the bile and pancreatic enzymes in the duodenum. Location of the duodenum. The duodenum is located in the abdominal cavity above the level of the umbilicus, opposite to the L1, L2, L3 vertebrae. The duodenum is a C-shaped loop of the small intestine. The concavity of the duodenal loop encloses the head of the pancreas. The duodenum, along with the pancreas, which is closely related to it, is the most deeply located portion of the alimentary tract and the least accessible to the physical examination. Measurements of the duodenum. The duodenum is 25 cm long and it is divided into 4 parts. The first part or superior part, it is 5 cm or 2 inches long. Second part or descending part, it is 7.5 cm long or 3 inches long. The third part or horizontal part, 10 cm or 4 inches long. The fourth or ascending part, it is 2.5 cm or 1 inch long. First part of the duodenum. Course. It begins at the pylorus, passes upward, backward, and laterally to the right side of the vertebral column to reach the neck of the gallbladder, where it curves downward to become continuous with the second part of the duodenum. Features present at this part are: this part develops from the foregut. It is the only part retroperitoneal. It is freely mobile and distensible part. It has no circular folds in the mucous membrane of its initial 2.5 cm seen as duodenal cap in barium mill radiographs. It is the site for duodenal ulcers and it is supplied by the branches of the celiac trunk or artery. Relations. Anteriorly, the first part of the duodenum is related with the quadrate lobe of the liver and gallbladder. Posteriorly, related with the portal vein, gastroduodenal artery, and common bile duct. Superiorly, it is related with the epiploic foramen, being separated from it by the portal vein and bile duct. Inferiorly, the first part of the duodenum is related with the head and neck of the pancreas. Second part of the duodenum. Course. It begins at the superior duodenal flexure, passes downward in front of the medial part of the right kidney, till the lower border of the L3 vertebrae, where it curves towards the left to become continuous with the third part. Features of this part: the second part at its upper half develops from the foregut and lower half develops from the midgut. This part lies behind the transverse mesocolon. It receives the bile duct and the chief and accessory pancreatic ducts. It is the only part of the intestine supplied by double rows of the vasa recta arising from anterior and posterior pancreatico-duodenal arterial arcades. Relations of this second part of the duodenum: anteriorly gallbladder and right lobe of the liver, transverse colon, transverse mesocolon and coils of the small intestine. Posteriorly, it is related with the right kidney and right renal vessels, right edge of the inferior vena cava and right psoas major muscle. Medially, this part is related with the head of the pancreas. Laterally, it is related from below upwards ascending colon, right colic flexure and right lobe of the liver. Third part of the duodenum: course. It runs horizontally to the left across the lower part of the body of the L3 vertebrae and crosses in front of the inferior vena cava and then takes a smooth curve upward to become continuous with the ascending part of the duodenum. Relations of this part: anteriorly, third part of the duodenum is related with the root of the mesentery, superior mesenteric vessels and coils of the jejunum. Posteriorly, right psoas major, right ureter, inferior vena cava, abdominal aorta and right gonadal vessels. Superiorly, the third part of the duodenum is related with the head of the pancreas with its uncinate process. Inferiorly, with the coils of the jejunum. Fourth part of the duodenum: course. The duodenum in this fourth part runs upward on to the left of the abdominal aorta from the end of the third part of the upper border of the L2 vertebrae, where it turns forward to become continuous with the jejunum. Relations: anteriorly, fourth part of the duodenum is related with the transverse colon and transverse mesocolon. Posteriorly, with the left psoas major muscle, left sympathetic chain, left gonadal vessels and inferior mesenteric vein. Superiorly, body of the pancreas. On to the left, it is related with the left kidney and left ureter. On to the right, it is related with the upper part of the root of the mesentery. Interior of the duodenum: mucous membrane shows evaginations in the form of villi and invaginations to form crypt of the Lieberken. Lining of villi is of columnar cells with microvilli. The submucosa contains mucus secreting Burnous glands. The muscularis externa comprises outer longitudinal and inner circular layer of the muscle fibers. The outermost part of the duodenum is serous layer. It is mostly connective tissue. Being a part of small intestine, the mucous membrane of duodenum presents circular folds. These called walls of Kirchner. But they begin in the second part and become large and closely set below the level of the major duodenal papilla. In addition to this, the interior of the second part of the duodenum presents few special features. These are major duodenal papilla. It is a well-marked conical projection on the posterior medial wall and situated 8 to 10 cm distal to the pylorus. On its summit opens the common hepatopancreatic duct. Next is minor duodenal papilla. It is a small conical projection situated 2 cm proximal to the major duodenal papilla. The axillary pancreatic duct opens on its summit. Third feature is arch of plica circularis. The plica semicircularis forms an arch above the major duodenal papilla like a hood. Next is plica longitudinalis. It is a vertical tortuous fold of the mucous membrane extending downward from the major duodenal papilla. Suspensory muscle of duodenum, also called as ligament of Treitz. It is a fibromuscular band which suspends the duodenojejunal flexure from the right crus of the diaphragm. Its upper end is attached to the right crus of the diaphragm and the lower end attached to the posterior surface of the duodenojejunal flexure. This fibrous band contains striated muscle fibers in the upper part, elastic fibers in the middle part, non-striated muscle fibers in the lower part. The ligament of Treitz fixes the duodenojejunal flexure and prevents it from being dragged down by the weight of the loops of the small intestine. It also serves as an important landmark in the radiological diagnosis of complete rotation or malrotation of the small intestine. Duodenal recesses or duodenal foci. In the region of the duodenojejunal junction, small pocket-like pouches of the peritoneum are formed. These are called duodenal recesses. These are sometimes responsible for strangulated retroperitoneal hernia. The important peritoneal recesses around the duodenojejunal flexures are superior duodenal recess, inferior duodenal recess, paraduodenal recess, retroduodenal recesses. Arterial supply of the duodenum. The duodenum develops partly from the foregut and partly from the midgut. The opening of the bile duct into the second part of the duodenum represents the junction of the foregut and midgut. Up to the level of the opening, the duodenum is supplied by the superior pancreatico-duodenal artery and below it by the inferior pancreatico-duodenal artery. The superior pancreatico-duodenal artery, which is a branch of the gastroduodenal artery, and inferior pancreatico-duodenal artery, it is a branch from the superior mesenteric artery. Each of these arteries divided into anterior and posterior branches, and respective branches of the superior inferior pancreatico-duodenal arteries anastomose to form anterior and posterior pancreatico-duodenal arterial arcades. Each anastomotic arterial arcade gives off a row of vasa recta. The vasa recta of the anterior arcade supply the anterior surface and those of the posterior arcade supply the posterior surface of the duodenum. Between the two rows of the vasa recta lies the head of the pancreas. The first part of the duodenum receives additional arterial supply from the right gastric artery, the supraduodenal artery of Wilkie, which usually a branch of the common hepatic artery, and the retroduodenal branch of the gastroduodenal artery, and some branches from the right gastroepiploic artery. Venous drainage of the duodenum. The veins correspond to the arteries but are superficial to the arterial arcades. They drain into splenic, superior mesenteric and portal veins. Lymphatic drainage. The lymph vessels follows the arteries and most of them drain into pancreatico-duodenal nodes lying along the inner curve of the duodenum. From here, the efferents drains into the celiac and superior mesenteric lymph nodes and ultimately via intestinal lymph trunk into the cisterna chyli. Nerve supply. Sympathetic nerves from the thoracic 9th and 10th spinal segments and parasympathetic nerves from the vagus passes through the celiac plexus and reaches the duodenum along its arteries. Clinical anatomy of duodenum. Number 1. Duodenal ulcer. The duodenal ulcer commonly occurs in the first part of the duodenum because it receives the acidic chyme from the stomach. In barium meal X-ray of abdomen, the first part of the duodenum presents a triangular shadow having a well demarcated base and less distinct apex called duodenal cap or duodenal bulb. If duodenal ulcer is present, this duodenal cap is said to be deformed. Next is duodenal injuries. The second part of the duodenum is most protected from the external injury because it lies in the paravertebral gutter. The third part of the duodenum is most vulnerable to external injuries because it gets crushed between the vertebral column and the anterior abdominal wall following the violence. Duodenal diverticula. They are congenital and almost always occurs in the medial wall of the second part of the duodenum. They are thought to be caused by the herniation of the duodenal lining through the gaps present in the muscle coat where arteries and ducts pierces the wall. Congenital stenosis and obstruction of the second part of the duodenum may occur at the site of the opening of the bile duct. Referred pain of the duodenum. The pain arising from the duodenum is poorly localized and referred to the central epigastrium. Thank you.